Doing?
I'm doing good.
Casey, how's it going? Dr. A,
Good morning.
what's going on?
Not much, a kind of gloomy day.
Yeah, another gloomy day today. So we can't have sunshine every day in Florida, but most of the time we have it.
Yes.
So today we're going to talk about the concept of plastic surgery for teeth. And what we mean by that is if you're going to have a mole removed, if it's on your back, do you need plastic surgery? You don't need it because plastic surgery implies it's going to be more expensive maybe, and you have to see a plastic surgeon, right? If you're going to have a mole removed on your back, you may just see a dermatologist,
Okay.
and you can expect it to
Scars.
the scar, where the expectation with the plastic surgeon is
No scar.
no scar, right? So let's just say that we're doing some bonding on a front tooth, which is to say that you fall down, you break the piece of tooth, and do I need a crown? How do we fix this? So you're missing part of the tooth, but the tooth is primarily intact. So in this situation, you're going to need bonding, but I would say it's not just any bonding. It is, you need some plastic surgery for the tooth. And what you would like to end up with is that piece that's added back, that you see no transition line, and that it becomes seamless and basically looks like the tooth did before it broke. So what's the difference? If you were to do bonding on the tooth, let's just say, just in the normal way, can you expect to see the restoration? Probably. And is that going to be of value to you if you can get it for less and in less time than having plastic surgery done on the tooth? It may be. It's an individual choice. So if you don't mind that, and if that having it done for less is worth it to you, then you may just want regular bonding. But if that's not acceptable to you, then you may want to think about having it done in a way where it doesn't show a scar. So how is that done? It's done with the technique. It is done with different materials, and it's also done with operator experience. So do you want to pick one of those three and talk about it?
Yeah. So the technique,
Yes.
in terms of if you have a front tooth that's chipped, how we prepare that tooth in terms of that surface to then rebuild what was lost is a technique that can be done differently. And if you want it to not have a scar, you have to think about how you won't have a transition and how you'll prepare that tooth so where you don't see that anything was ever done to that tooth.
So is it a different technique than you learned in dental school?
Yeah.
Absolutely. Night and day technique. So we have the technique that is going to be different, takes a little bit more time and expertise. The material is going to be different. So again, if we're comparing it to just regular bonding, the material that you use if you're wanting to do plastic surgery on the tooth and have it disappear, you're using something for the back of the tooth that's going to block light transmission so you don't see a transition. You're also going to use something to replace the dentin of the tooth, the middle of the tooth that's a little bit more opaque, that is going to mimic the interior of a real tooth. And then you're going to use something for your final layer that is going to replace the enamel that has more of a glass-like appearance and has some translucency to it. So yes, 3, sometimes 4 different materials, types of materials. So having mastery over those materials is what you're going to want your dentist to have. Well, what about operator experience?
And that's the experience to know what kind of materials to use, the color, and how you want to layer those materials. So that analytic eye, that aesthetic eye, to be able to see what the rest of your teeth look like and be able to match that.
And I would also add the frequency of doing the procedure. So if you're doing it once a month, you're not going to be as confident that you can make a seamless transition. If you're doing it daily, you can do it with confidence, and you can provide the value for paying a little bit extra for plastic surgery on the tooth. And so those are all important distinctions that you may want to think about. So let's just say that you have something, say that's not a break. Say it's a cavity between your front 2 teeth. You have to ask yourself, this is not real straightforward, right? Because if you have a cavity between your back teeth, does it matter so much if there's a scar?
No, because it's in the back.
Yeah, it's in the back, it's not going to show. If it's in the aesthetic zone, think about it between your front 2 teeth. What are you going to want to have?
Something that no one's going to see or notice.
Would you be okay if, even if it's a small cavity, if in certain light you could see that transition?
No.
Probably not. Probably not. But some people would be. You know, the husband may be like, just give me the regular bonding. And then sometimes they come back and say, my wife doesn't like this. Yeah, or vice versa. So it's really a neat concept because we were thinking about it. It's like, gee, how much time are we spending on these front fillings? And it's like, gee, it's like we're doing plastic surgery on the tooth. Absolutely like that. And so if you were to need something like this, consider, and some of the names that we give to this, and it's you can use a BioClear technique or something we call a Brazilian technique that we've learned from Newton Fall in Brazil. And we can have another blog where we talk about the difference between those two, but that is how we achieve that result that we're talking about. Thank you.